Today, I have my guest, Emily Miller, with me. Emily is a good friend from Yale Graduate School, and we have been friends for such a long time, and I'm thrilled to have her on this podcast. Emily holds degrees from UC Berkeley, Yale University, and is the founder of Emily Miller Aesthetic Medicine. Emily Miller Aesthetic Medicine is a boutique aesthetics clinic in West Vancouver, British Columbia. She runs this practice along with her husband and medical director, Dr. Vishal Gupta. Emily is both a registered nurse, certified aesthetic medicine practitioner, and mother of two adorable children. She will share her fascinating journey into aesthetic medicine and what she has learned along the way. I am so excited to have her as a guest on my podcast. Welcome, Emily. I'm so glad you're here.
Hi, Val. Thanks for having me. This is my first podcast, actually, so I'm excited to be here too.
I remember when we were in grad school, we would go dancing, and I thought that I was a good dancer because you were so good, and I wasn't, but you were amazing. I have such nice memories with that, and then also studying, and we just had so much fun together.
And yeah, you were like my dancing partner, Val. We had so much fun hitting up the New Haven grad school nightclubs.
Oh, yeah. It was fun. It was a lot of fun. I don't remember all the names of them, but they were. It was fun times, and we had all of the nursing school. Just the issues everyone has in nursing school, like studying, trying to prepare for exams. And it was awesome to have you as a partner as we started our nursing journey together. And Emily, you have such a fascinating story, and I want to hear about it. Can you tell our listeners more about what made you decide to go down the route that you did, and what led you to the decisions to become this amazing provider and the founder of this practice?
So back when I was in nursing school with Val, I had no vision of, what my career has become today. I really had no idea at that point what it would evolve into. I just knew that nursing was a career where I would have flexibility. And let's say I did one type of nursing for a certain amount of years and felt like I wanted to switch it up and try something else. I knew that I'd have the ability to do that within this profession. And now I've actually been able to, make that come to fruition. So I practiced, after graduating Yale, I practiced in inpatient psychiatry for several years and also psychiatry in the emergency department. And I did that both in the States, and then I immigrated to Canada 10 years ago. I met my husband at Yale as well, and he's from Vancouver, Canada. So I made that leap to come and begin my nursing career in Canada 10 years ago. Also still working in psychiatry. And I did that for about almost 15 years now. So I really enjoyed the work that I did, but to be honest, change needed to happen because both my husband and I are shift workers. And once we started our family and had children, like once we had the first kid, it was hard enough for us to match our schedules with his hours and my hours, and to be able to have any kind of childcare that can support those long hours of hospital workers. And then once we had the second kid, it was like no longer feasible. So I knew that that's when a change needed to happen. And I got creative and I thought, what other practice of nursing could I go into that would allow me to still work? And so I just happened to be getting my Botox done one day. And the doctor who was injecting me said, "Hey, you're a nurse. We're hiring a nurse. You should apply." And that's when this light bulb went off. And I actually had no clue that the field of aesthetic nursing was even a thing. I didn't know that nurses could practice aesthetic medicine. Like I was kind of new to Botox myself at that time. But that's what sparked the idea. And that spark grew into a flame really quickly. I went home and I talked to Vish, my husband, about it. And I said, "Hey, what do you think about this? I actually think I'd be really good at this. And I think I would really enjoy it." And he was super supportive. That night, we looked up training programs for aesthetic medicine, and signed up like immediately. So I did a 1-year training in aesthetic medicine. That was through the Canadian Board of Aesthetic Medicine, and traveled all over Canada for that period of 1 year, getting hands-on training, lots of didactic, really learning everything I could to enter this new field. And after that training, I felt really well prepared to go into practice. I worked for another medical spa for sort of to get my start, and didn't take long to find out that it wasn't a fit. And I learned a lot about this industry of medical aesthetics, how it's sort of like shiny and glamorous. And to a nurse, it looks like, oh, this is going to be so fun. And you're just going to like, chat with your clients and absolutely love your work and it's no stress. But there's this sort of like other, almost darker side to medical aesthetics where it's a business.
Yeah.
A lot of it is corporate. It's all private, and some of those like values that you have practiced in your career in nursing, they get a little bit like tested. So working for someone else was not a fit for me and for my values. And I started looking for other work and, shadowing at other clinics, and also seeing this pattern of I didn't want to work in any of these clinics. And that's what really lit the fire under me to do it myself. And I talked to Vish and I said, hey, you can be my medical director, because in British Columbia, a nurse needs a physician to be on site when injecting. Okay. And I said, you could be my medical director, I could be the practitioner, and we could start our own business. And this way we can really do it the way that we want to do it. And we don't have to compromise our values, and patient care can really come first.
That's amazing.
So that was about 2.5 years ago that we decided to go on this journey, and we founded Emily Miller Aesthetic Medicine. It's grown tremendously, and we've been practicing for 2 years in a home-based clinic. And now you're the first person I'm telling this to, but we're actually now scouting out commercial locations, and we're going to expand and grow a team. And so it's really grown rapidly, and we've been really blessed. And I feel like I'm at a place in my career where I don't want to do anything else. I see myself, Vish is like, he's burnt out from the ER, and he's like, I want to retire in 7 years. And I was like, okay, well, sure, you can retire, but I want to do this for the rest of my life.
Absolutely. That's amazing. And congratulations. That's awesome. And I really feel like you are the perfect person for this. Like, I mean, I've been following you along your journey, and it's just amazing to see the two of you work together. And I can clearly see your passion for this. So congratulations. That's amazing, Emily.
Thanks, Val.
Now, for moms, what do you feel like? I mean, so I just started Botox recently too, and I actually reached out to Emily. I'm like, is this okay? Is this a thing? I don't know. Tell me your thoughts. So I took a picture and sent it over social media to Emily. I'm like, what do you think I should do? And the place that injected me, they did a good job, and I'm like, okay, well, this was fine. I'm going to keep going back. I mean, obviously, it's a personal decision, but I know that I have a lot of other moms asking me about Botox, and some people will be like, oh, like a lot of nurses going to Botox. So what would you tell our listeners if you're considering Botox, but you're a little hesitant, or what do you recommend?
Yeah, so this podcast is for moms, right? And like I myself, what made me want to start getting Botox back when I was 33, I'm 40 now, was having my first kid and just being so sleep deprived and tired. And at that age, I just, we're losing collagen and elastin in our skin, losing collagen at about a rate of 1% every year from the age of 25 onward. So you start to see these changes in your skin. That's a natural part of aging, but there are preventative treatments that are really like minimal intervention that can address those things. If you're looking in the mirror and you feel like, I just look so tired or I feel so haggard, and like that's how I was feeling, and I wanted to do something about it. So a friend of mine who had been doing Botox, she's a bit older than I am, and she'd been doing Botox for about a decade. She was like, now's the time to start it. And you can, you can sort of freeze your face in time. Like, you don't have to continue to age rapidly. There's nothing wrong with aging, but it's when it's this like accelerated aging process and it's happening more rapidly because sun exposure is stronger than it's ever been, and we're just getting, exposure to indoor lights, blue light from our phones. We have all these environmental stressors on our skin. And so if you want to be proactive to sort of do something to slow down that accelerated rate of aging and just look and feel your best, then I think it's a really great thing to consider. And all of my clients that come in, a lot of people come to me who it's their first time trying it. Many of them have tried it elsewhere before and they just decided to switch providers. But I get a lot of people who it's like that they're making that decision that they want to, it's time to do this for themselves. And honestly, none of them regret it. Like, it's kind of magical what it can do for refreshing the face, relaxing, these like scowl or frown lines. That's a really common concern that a lot of people have. For me, myself, I had really intense crow's feet because of all the years of sun damage that I'd exposed myself to. I grew up in California. I was like slathering on baby oil and laying out by the pool all day. I even had a tanning salon membership, So now things are so much better. I literally at 40, I look better than I did at 30. And it's because of the treatments that I now do.
Yeah, that's amazing. What would you say for moms who are considering it? Like, where should they look for reputable places to get procedures done?
That's a really good question. I think that you can be ultra choosy about this. So I sort of alluded to, when I entered this industry, kind of like peeled back the curtain of Oz and saw what was like happening behind the scenes. And you don't see that as a client because it's all like fancy med spas that spent $1 million on their renovations and they look so nice. But a lot of people providing these services are like seriously undertrained, and that's kind of scary to learn about. I actually work as an educator now for the Canadian Board of Aesthetic Medicine. I've been doing that for over 2 years. And so I train the new providers and I really drill home to people, like, you cannot stop here with your training. Once the program's over, like, you have to keep finding other educational opportunities, find a mentor, invest in private trainings, because not just the years of experience of your provider, but really the level of their training is going to make such a difference in your outcomes and their knowledge. Because say they learned bad habits from the start and they've just been doing those bad habits for the past 5 years, like, then you might not get a great result, right? But I would say the people who are educators themselves, that's a really good sign. So if somebody is hired by, a national teaching institute or by one of these companies that provide the product, like Allergan or et cetera, then those people tend to have a pretty high skill level because they're the ones who've been selected to train other providers. That'd probably be the best tip that I have, as well as a place that is really doing it by the book, where the medical director or the physician really is on site, or you're being injected by a physician themselves. And you just want a place where you feel really comfortable and safe. Ask around, ask your friends. More people are getting this done than what you think. If you have a friend who like looks really good, be like, have you ever tried Botox? And see where they go. Like if their face looks great, then that's a good indication that yours might too. So really, like, personal recommendations would be a great way to source out a place too.
That's great. That's good to know. Thank you so much. Now, what else do you recommend? Like, I know that there's so many procedures out there. I know, like, when I look at websites, there's not only Botox, but a bunch of other kind of like, I have to look up everything because I'm not familiar with a lot of the terms and I'm in medicine. So what are the other areas that you feel like are helpful for skin
Yeah.
and all that aging?
There is so much we can do for skin in 2023. It's almost overwhelming to people who do, get really curious about this and want to start researching on the internet and see what their options are, because like technology has come so far and there's a lot of private investment into these technologies, because this is all a private sector of medicine, right? So it's like heavily funded. So we have the capacity to do so much for our skin with treatments nowadays. Some really popular ones for the last few years has been radio frequency microneedling. This is a game changer for people who either don't want to have a surgical intervention to tighten skin, like they are not ready for a facelift, or maybe they don't ever want that option, but they want some tightening of maybe when we start to get like saggy skin in here, the jowls. These are called marionette lines. These are called nasolabial folds. So radio frequency microneedling is a way to tighten skin and produce collagen and elastin. That is non-surgical. It's a really easy procedure. There is very minimal downtime. And so that's super popular. Other really, I think where the future of aesthetic medicine is going are in collagen stimulating procedure or treatments. So Sculptra Aesthetic and Radias are two examples of that. These are products that don't leave anything foreign staying in your body, but the product that is injected stimulates your cells to produce their own collagen and elastin again. So you're left with a supernatural result, and it's this bioregeneration that is just making your face healthier and having your own collagen again. So those are really, really lovely treatments that they are appropriate for anyone, whether you want to replace lost volume. Like I have Sculptra in my face. I also have dermal filler in my face, and both can be used at the same time. You want to use dermal filler only as much as you need. And I don't think that that is the best maintenance treatment going forward, like many years. I would prefer to see getting somebody on Sculptra and producing their own collagen about the age of 48 onward is going to be a better fit for them than just like continuing to fill with dermal filler. But dermal filler is a really popular procedure as well. We see it all the time, especially in people getting their lips filled. There's the lips where you can look at them and you're like, oh yeah, that person has lip filler. And that's not my taste. That's not the type of lip filler we do. I really like a result that's like imperceptible, where, you could notice a change. Maybe your friends could see a subtle change, but nobody who just met you could look at you and tell that there's filler in your face. Yeah. Those are probably the most popular treatments, I would say. Microneedling is a big one as well. And PRP is another regenerative treatment that can treat hair loss. So both men and women are treating thinning hair and balding with PRP, which is platelet-rich plasma derived from their own blood. It's super fascinating. There's so much in this field, but I would say that those are my favorite treatments and the most popular that I see a lot of people getting.
Well, that's really interesting to know. Thank you so much. Now, another thing that I just want to touch base with our audience is that I feel like, with Botox and with all these treatments, I'm glad you said, Emily, like more people are doing it than we like really realize. But also at the same time, it's what you're comfortable with. I think all moms, they're all beautiful. We're all like just trying to feel our best. So whatever you feel like is best for you, um, do that. And it brings the point of, I have learned so much when I've been looking into, like, with my writing and with these talks on all the neuroscience behind, like, when we smile more, when we project with confidence, we feel better. Like, we're tricking our brains into that, which I just think is so fascinating. So I mean, if Botox, if you're or these are you're on the fence with, just maybe like kind of see, like, if I smile more, if I expand more, is that helpful? But I think that this is so much. I feel like so many moms are interested in this, and that's why I want to make sure that we know exactly what there is out there. And I think Emily is such a great resource to give us that information, and I really appreciate her expertise with all of it. Um, Now, a fun thing that you do, Emily.
Val, can I tell you one
Yeah,
thing? Because
yeah,
what you said is backed by research. Where yes, if you smile more, we have mirror
yeah,
neurons that help us to feel happier. Well, we find that using Botox makes people improves their mood. So that's
really.
actually proven,
Oh,
and
that's
it's used
great.
off label in some cases to treat depression. And so
That's
yeah, people, your mirror neurons fire when you look in the mirror, and this is why it's called a mirror neuron. What you see, if your outside appearance looks refreshed, happy, not tired or angry, it tells signals to your brain that you actually feel that way. That's how
yeah,
you interpret that feedback of looking in the mirror. And then in turn, it does begin to improve your mood. Also, just the confidence boost that comes from looking in the mirror and feeling like, wow, I look really fresh, or just
yeah,
not having any negative reaction. And you could be a super secure person and know that your beauty comes from within. You're honest, you're kind, you have great values. Those are the things that truly matter. But the way that we feel about our outward appearance, when we feel like it is congruent or in line with how we feel on the inside, then that's a really good feedback mechanism as well. We sort of want the outside to feel like that matches the inside, and we're not sending signals to the world that we're angry when in fact we're not, because a lot of people have like this worry wrinkle and it makes them look like they're angry. My husband had it, and I told him, I said, honey, you furrow your brow all the time. I know you're just concentrating. It's how you focus or how you squint in the sun, but like, it's time for Botox. And then another great added benefit is if you get headaches, it helps relieve chronic headaches. There's a lot of therapeutic uses for the medication as well. And when I say Botox, it's just important to note that this is a neuromodulator medication, botulinum toxin. Botox is a brand name, but it's sort of a household name like Kleenex when you're talking about a facial tissue. There are other brands of Botox as well. So that's what I mean when I say Botox. But yeah, it has therapeutic applications. People with chronic migraines get incredible relief. People with neck and shoulder tension, and this applies to moms too. If
yeah,
you have chronic pain, you're carrying the baby, you have shoulder tension, we're carrying the heavy diaper bag. It's a lot of strain sometimes on our upper body, or even just like nursing and the position that puts us in. If you get this positional neck strain, um, botulinum toxin can really help to relieve the spasm in those muscles and give you long-term relief. So many applications, therapeutic uses. It's a wonder drug.
that's amazing. Like, you are such
Yeah.
a wealth of information, Emily. Like, I had no idea. I mean, I knew about the headaches at one point, but I didn't know. Like, it seems to be there is so much application for it, and that's amazing. Like, the I like have read about those mirror neurons and all, and just to be able to. I mean, even like today, I went to Starbucks earlier. I try to like somehow with three kids get my writing done and get my work done. So what I do is, the days my husband works from home, which isn't all the time, but when he does, I'm like, okay, well, I have until 8 a.m. Let me go to a coffee shop or something, get some stuff done. Don't necessarily have to do that, but that I know helps me. So I was listening to a song on the radio, like overhead, and they were actually, it was an older song. I don't know what the title of it was, but they were talking about smiling and projecting yourself to the world in this positive way. And when you're projecting positivity out, then the world brings that positivity back. It's kind of like the what you're putting out. Even it's Dr. Bolt Taylor. She writes a fascinating book on. It's called My Stroke of Insight, and she talks about the differences between the left brain and the right brain. And the left brain is so much about me and my individuality, which is so important, but also the right brain is a lot focusing on where we are in the world and how what is our mood projecting out and what is the energy that we're giving out. So it's just all of this is so fascinating, and then to tie it into Botox and all this is just I'm like feel like this is just such an interesting conversation. So thank you, Emily.
Yeah, you're welcome. It is a neat thing to explore. And I like just to wrap up kind of what we were talking about with, moms who are curious or considering this, or maybe just learning about it for the first time, there is little risk to just trying it once and seeing how you like it. So there are risks associated with any medical procedure. Some of the most common ones with neuromodulator treatment or Botox, the common places to treat are the upper face. This can sometimes change the shape of our brows. It could make your brow sit lower. That's not what we want. It could make your brow sort of one of them peak or both of them peak in an odd way. That's not what we want, but that can be touched up. But if any of those things happen, or say you just don't like it and don't want to do it again, it does wear off. So it's not a long-term commitment, and you're not going to be any worse off after having had a treatment. It's not like, your face will basically just return back to baseline. If anything, it'll be better because you've staved off those wrinkles from getting deeper and becoming like ingrained lines for that period of time that you had the medication in effect. So you can just try it, and if you don't like it, you don't ever have to do it again, but you'll probably love it.
So is that kind of how, as far as I understand, so I had it done like with the crow's feet area. It's probably where I
Mhm.
am now, but so I was told that it's helps me because I don't use those muscles as much when I have Botox in, so it's kind of preventing further use from it. Like, is that kind of, am
Exactly.
I explaining that right?
Yep. Yep.
Okay. Yeah.
It's softening your lines. A big worry that people might have is, am I still going to have expression in my face? I'm a very expressive person. I mean, I have Botox in my face and I can lift my eyebrows,
Yeah.
and we can dose you, if you want to have movement, we can dose you so that you have movement. If some people want to be frozen, and we can accomplish that, right? But the purpose is to relax the muscles so that in certain places they're not contracting, but in certain places they are. So you can still have, a full bright smile and show expression in your eyes, right? The movement that's hardest to make, and you often can't when you get Botox treatment, would be to furrow your brow or to really
Okay.
frown and scowl. So if you want to look angry at your kids, they'll know you're angry because look at me, like you can tell, my eyes are still angry, but I'm not making the wrinkle. So that's the
Ah,
difference. Yeah.
well, there you go. There you go. And also I remember reading, I don't remember the exact study it was, but I think it was through one of the CE courses I was taking on Botox, and they were saying that as we age, like this part, like our smile line, or like we're using more of the frowning, so we're using more of that and not smiling as much. So it's just kind of
Mm,
goes to show how as we're age, we're kind of like, I don't know, either concentrating more, or are we just reminding us to smile more, because it sounds like it's all
sure.
they're using it.
Yeah. Maybe concentrating more, maybe your
Yeah.
eyesight is going and you're straining a bit more for your vision. There's a lot of reasons why we make these expressions. So
Yeah.
just know that having the medication in there isn't going to affect your functioning at all. You can still, do and express everything that you need to express. It just prevents deep lines and wrinkles from forming.
And one other question that I had just thought of, as far as how long do you expect to see results? Like, do you see immediate results when you get it, or does it take a
You
little bit of time?
see you see results very quickly. So depending on which product is used, so if you're using a Botox brand name product, that takes a little bit longer to kick in. It's 5 to 7 days you begin seeing results, and you see your full results with all the products at 2 weeks. If you're using something like Nuceiva, it's called Jeuveau in the States, or Xeomin or Dysport or other brands, those kick in a bit faster. They've come out more recently since Botox brand, so they improved on the medication slightly, and one way it was improved upon is that it kicks in faster. So in about 3 to 5 days, you would see your results forming, and again hit that peak at 2 weeks. That's the time to then follow up with your provider and see if any touch-up needs to be made. Like I mentioned, if one eyebrow is asymmetric to the other, very easily we can just place a little bit more product on that overactive brow and smooth it out. So you want to do your follow-up at 2 weeks, and then the medication at 2 months is when 50% of it has worn off. It's slowly wearing off from that 2 week mark. So you start getting a little bit of movement back after about 2 months. Usually this stays relaxed the longest, and crow's feet and forehead are where you see it, some movement returning at that point. by 3 to 4 months is when it's fully worn off and out of your system. So the 3 to 4 month mark is where you would return for your next treatment if you want to treat at that point. And some people get a lot longer duration out of it. Some people, everybody's anatomy is different. Some of us has very strong muscles and some of us don't. So some people only come in twice a year. It depends on age as well. It depends on a lot of factors. So there will be some individual variability, but on average, 3 to 4 months is how long it lasts.
That's good to know. And then one other thing that's kind of just a fun thing that I noticed on your social media is that you are comparing celebrities or talking about celebrities and like what you think that they have had done. Do you want to share any information about that? I just thought those were kind of humorous.
Yeah, so on my Instagram account, so my handle is at Emily Miller _ aesthetic medicine. If anybody is interested in these things, I like to do a lot of teaching on there and keep it light and fun. And I have this series called Celebrity Do's and Don'ts, where I will break down a celebrity for that week and the work that I think that they've had done. And some of them are examples of work that I would say has been really well done, and it enhanced that person's features, or it is very almost imperceptible. And so I just think it's kind of fun to like look and maybe have an insider in the industry have their opinion on like what treatments might this person be doing to get a result like that. And also like in cases where we look at that person's face and we're like, oh no, something went wrong. What was it and what went wrong so that we could avoid making the same mistake, right? So I think it's always fun. I feel bad for celebrities that like they get, picked apart and dissected. So I try to be really kind in the way that I approach it. I don't want to bully anybody there, but it serves as a great example because it's these faces that we're all super familiar with, and we've seen them over and over again. And so to kind of get that insider's eye of what it took to give them that look, because like almost everybody in Hollywood, they're getting rhinoplasties, they're getting some type of work done. And so knowing what it is, if you're into this stuff, I just think it's really fun.
Yeah, absolutely. And so, can you tell us again, how do we access those your information and your social media so we can follow along with everything?
I'm on Instagram. My account is at Emily Miller _ aesthetic medicine. And I just started a YouTube page. It's brand new, but I'm putting some content on YouTube as well. And so that's the same handle at Emily Miller _ aesthetic medicine.
Okay, that's wonderful. And I'll put that in the link as well so you guys can access that on this podcast. And thank you so much, Emily. I loved our time together. We need to do it more often. And thank you again for everyone for tuning in today. So be sure to subscribe and let me know your thoughts. Thanks, y'all.